Okay, so here I already mapped everything where I need to lift the jowls so that the jawline is more. I numbed the area already.
Okay.
So this area is numb, so I go with the needle 18 gauge and sub-Q. When I lose the resistance, it means that I'm under the dermis, and I'll try to make a little path like this with the direction of the threads. Okay, and I'm using here mint fine. Okay, so I'll try to go with a 90 degrees angle first, or so, like 70, 80, and then I'll push down till I lose resistance as well, the same as I did. Okay, here I lost resistance. It's good to put the thumb here. Sometimes we're advancing so that okay, everything stays in one place, and then I'm going in the direction of the first thread anterior, and I'll try to advance as much as possible because it's gonna always retract. Okay, and I put my finger here so that the thread stays in place. And here's the first one. I always like to do 2 threads on each side from one entry point because I like to twist and tie at the end. The same thing, I lift up like this, and then in the same entry point, little pressure. Okay, I lost resistance, and I direct it wherever I want to, and it's gonna be almost like 10 degrees. And okay, the same thing, I try to advance more than I wanted to because okay, this should be fine. It should be because it's gonna always retract a little bit. So these are the 2 threads. They're in good position, so when I pull them like this, you can see there's no dimpling, nothing. So it seems that they are exact subcutaneous, good depth. And I'll try to engage now the barbs a little bit by pushing up, and then the same thing by doing this twisting. You see how I pull back and I engage more barbs, and then I like again to do 1 knot. Okay, so if you see, like, I almost over pulled everything again, which is fine because remember I'm going to release a little bit after. Again, before I cut it, I like to disinfect a little bit more because that's gonna be where we're gonna cut the knot here. I get as close to the skin as possible. Again, I pull up and I get it as close as possible. Okay, so the knot now is cut. So, and then with this movement, the patient gonna hear a little pop. You know, that's nothing. That's just the knot is going under the skin. That's very normal. It's very important to tell the patient what you're doing so that they understand. They don't think that something actually broke or something. Okay, and then I continue. You see, the knot is under the skin now, and there's nothing. I feel here it's very nice and smooth, so there's nothing coming out from this area. Everything is subcutaneous, so there's way less risk of any kind of infection. So that's good. So when you do the thread, there's some irregularities here. Tell the patient we can a little bit correct. You don't want to overcorrect because they can see the jawline. Here everything will be smooth by itself, so try again to correct a little bit, but not to overdo it because that's the lift actually. So okay, that's good for this side. And I assure the patient that this will smoothen out by itself, so don't worry about it. It seems a little irregular at the beginning, and then if we go to this side, the same, the jawline is showing better, and then we can just release it a little bit. So again, you know, when I was doing it, I over pulled so that I release a little bit, and then the thread will still be lifting something. So again, the same thing. This will smoothen out by itself. I tell the patient in a couple of weeks they can, if 2-3 weeks, if everything's not irregular, still needs to be released a little bit, then we'll do it at that time.